It's a real privilege to be here and be amongst you all last night to have a chat about how you're finding things. I'm a nurse clinician at the Christie. It's a peculiar title, but it's an advanced nurse practitioner, essentially. And I've been working with melanoma patients for about 20 years. So I was there pre-treatment, and most conversations that I had were bad news, or, there isn't anything we can offer, unfortunately. And I feel really privileged to have been there when these dramatic changes happened in terms of treatment. Usually with cancer treatment, things happen slowly and progressively, but it was practically overnight that things changed in terms of melanoma, and suddenly from having absolutely nothing, we had 2 really effective treatments. And I still get giddy about that when I see how things, tumours shrinking down dramatically. I still get really excited about it. But obviously these things come at a cost to some people. And I've been asked, some of you are living with treatment at the moment, on treatment, but we don't want that treatment to dominate your life. We want you to be able to still enjoy your life alongside the treatment. So I've been asked to talk about some tips on treatment and managing your day-to-day lives. So I've picked the common side effects that we as healthcare professionals would probably put in the not that serious category, but they're all side effects that really can affect your quality of life day on day. So skin rashes, itchy skin, dry mouth, which I've got at the moment, pain in joints, and stiffness in joints is a relatively common side effect and very difficult one to manage. And the old chestnut fatigue, which in all cancer treatments is an absolute really difficult one to advise people on. So the effect of side effects have effects on the rest of your life, as we said. So apart from the physical discomfort, that in turn can lead to lack of sleep, difficulty concentrating. It can disrupt your social life, it affect all your leisure activities, your self-image. You don't feel like you anymore. You don't feel like the person that you were pre-treatment. And that decreases your self-confidence, with some people can cause embarrassment and increased anxiety. Anger, frustration, depression, all can come together to have a really significant impact on your day-to-day lives. So the first one I want to talk about is skin rashes and managing skin conditions. And for all of these conditions, we can help us in terms of healthcare professionals, but there are things that you can do to help yourselves and empower yourselves to manage these. So if you imagine that your skin is a brick wall and it's like a barrier, so it keeps all the good things in and it keeps the bad things out. And the skin cells are represented by the bricks, and the mortar, the oils and the fats that keep your skin healthy. So when your skin's inflamed, it produces less of the oils and less of the fats, and so there's less to hold the bricks or the cells together, and that makes the skin more porous and more dry, and it's unable to retain water. So one of the things that happen when you have inflamed skin is that allergens can penetrate more easily, bacteria can penetrate more easily, and then the skin becomes more inflamed. And when you itch, the skin becomes more inflamed when you scratch. And it's just like a vicious cycle. It just keeps getting worse. So some tips on caring for your skin. Always keep your skin clean. Have a shower or a bath at least every day. Don't use soap that's scented, or don't use soap at all. There's creams that you can buy, aqueous cream, or you can get on prescription. They don't lather up, you don't feel like the soap, but they do get you clean, and they provide moisturizer, and they don't strip your skin of the healthy oils. When you're drying your skin, pat it dry, and then moisturize. I can't say that enough. It's so important to just moisturize your skin. It can make such a difference. We don't need to necessarily use steroid creams in most cases if you use a lot of moisturizer. So do use soap substitute, aqueous cream. Put any cream in the fridge before you put it on, because it obviously then has a cooling effect and a more soothing effect. Use bath or shower oils that are particularly made for sensitive skin. There are plenty out there. Some will suit you, some will suit somebody else, someone else. It's a very sort of unique thing that is particular to you. Obviously, drink plenty of fluids, eat a varied diet, and try and distract yourself. And I'll talk a little bit about distraction techniques later. I often say to patients, if they're just sitting in the evening and they find that they're scratching, to get an old shower cap and put some cotton wool in it and pack that with ice and just put that on the area that's itching, and it will stop you scratching it. And scratching actually increases the inflammation and makes it worse. So if we can avoid scratching, that does improve things. Use pillows and bed linen that's man-made fibres. Things like feathers do have more allergens in them. So use man-made fibres, wash them regularly, and common sense, but wear lightweight man-made fibres. So don't use perfume, soap. If you can, don't use soap at all. Don't just wash with water alone, because that will dry your skin as well. Overheating makes the skin worse, so try and keep the house cool. Don't bathe in hot water, because that increases the inflammation. So if you're having a bath, make it sort of a bit on the tepid side, and avoid tight clothing and lycra and things like that. If you are exercising and you're wearing lycra, take it off as soon as you've finished, and probably have a shower at that point, and put something loose on. So fatigue, we'll go on to fatigue, and I'm sure everybody in the room at some point has suffered from fatigue, and fatigue has many causes. But it can cause, in itself, it can cause many, many symptoms. So apart from not having any energy or strength, you may find it difficult to do very simple tasks. Brain fog is very, very common with fatigue. Making decisions and having conversations and trying to remember what happened 10 minutes ago, it's difficult. It can cause dizziness, difficulty sleeping more, sleeping at the wrong time of the day, so you may be awake all night but really tired during the day and need to sleep during the day. And that then leads to low mood. Low mood can cause fatigue, so chicken and egg situation really with that. And you can be exhausted after doing either even light activity or moderate activity. But fatigue has many causes, so speak to your healthcare professional if you are suffering from fatigue, because there are some investigations that we can do in the first instance to try and analyse why you're getting fatigue. So the cancer itself can cause fatigue. If you have active cancer, that in itself can cause the metabolism to rise and cause you to be more tired. The cancer treatment, as we all know, can cause fatigue. And while we don't know the mechanism of that, we don't really understand the mechanism of why the treatments cause fatigue. We know that they definitely do. Pain. If you're in pain all the time, you're going to be tense, and that in itself can lead to fatigue. So if you do have pain, please take painkillers. Take them as prescribed and take them regularly. You don't need to be brave. You don't need to worry about masking something. I speak to so many patients who are reluctant to take painkillers, but they are really important and they really do improve your quality of life. So just be aware of that. And then commonly anemia can cause cancer. We could do a blood test and your iron may be low, or your hemoglobin may be low, and that's something that can be corrected. Anxiety and depression and stress. You may not feel depressed. You may think, I'm not stressed, I'm fine. But your body will tell you if you're under stress. You may feel mentally okay, but your body understands that you are going through a stressful time, and it will identify that. So, and that will come out in other ways, and fatigue is one of the ways that it does manifest itself. And then if you've been on treatment, we could check your thyroid. Your thyroid may be underactive. Your cortisol levels may be low because of the adrenal glands not working properly. So please tell us, you know, it's not something that we take lightly or dismiss. It's something that we can sometimes do something about, and we can give you advice about how to manage it. So stay active. It's very difficult if you're feeling really tired to get yourself out there, go for a walk, just get some fresh air. It's hard to motivate yourself, but more and more studies are showing that exercise is really important if you are fatigued. There are also studies that show that resting and doing nothing all day absolutely doesn't improve fatigue. It makes it worse. So it's difficult, I know, but just force yourself to even just go out for a walk, go for a swim, just do some kind of exercise and get yourself out there. And then distraction again. Again, I'll talk about that in a moment. Interacting with people, again, you may not feel like going to meet your friends or, you know, just going out for a coffee somewhere with somebody. You may feel too exhausted, but actually that's a kind of distraction. And when you do get together with friends and talk about other things, you will find that you've probably enjoyed it and you feel better after it. Eating well, you know, this is a common theme, and I know that there's a talk on the microbiome this afternoon, which is going to be really interesting, so I won't go too much into that. A lot of my patients have found yoga very helpful because it's not very strenuous exercise. It doesn't necessarily have to be very strenuous exercise, but it's very, very helpful, and it helps with your mind as well. And also, if you can learn to meditate, there's a lot of apps on your phone that you can meditate with, and they're very useful. And again, things like relaxation therapy, mindfulness. One of the really things that I find useful with patients is asking them to use a fatigue diary. There's one available on the Macmillan website. If you just Google Macmillan and fatigue, it'll come up on there. But I would suggest you record the days you have your treatments. If your treatment's intermittent, the days that you have your treatment, and does the fatigue match up with those days? Is it a week after? Is it a month after? And obviously, each day record when you have more energy, when you feel really fatigued, to see if you can match that up with anything that you're doing, anything that you're eating. Record your activity, your exercise, what you've eaten, when you've eaten it, and your mood. So are you feeling happy? Are you feeling low? Are you feeling angry? And see if you can match up, if there's a pattern when you're getting fatigued, and is that actually activated by something that you're doing? And you'd be surprised if you look back over time that sometimes you can identify a cause and you can deal with that in your own way. So another one that's really difficult, I think, and it's difficult for us as healthcare professionals to manage, is joint and muscle pain. I know a lot of it manifests itself in very different ways, and it equally with immunotherapy and targeted therapy, it can be a problem. And I know some people some people have one pattern, some people have another. I have people who wake up one morning and their elbow's sore, and then their knees sore the next day, and their ankles are sore the day after. And some people get really stiff in the morning, they feel like they can't get out of bed, but then when they get up and exercise, they actually feel better and the pain settles down and the joints relax a little bit. If you need medication, if you need anti-inflammatory drugs or you need painkillers, if you're getting joint pain, then please take them because they do help. Cold packs, if you find that joints are inflamed, few days that they become inflamed, ice packs can help reduce that inflammation and subsequently help improve the joint pain going forward. But warm compresses as well also help just soothe the muscles and relax the muscles. Support bandages like tubular bandages or wrist splints can help. Again, exercise is absolutely really important with joint pain. It's counterintuitive to think that it does help, but it really does. Because if you imagine the muscles are supporting the joints, and if the muscles are weak, there's more pressure on the joint. So if you can strengthen the muscles around the joint, then that's going to provide more support for that joint and then lessen the pain. So it is really important. I know it's difficult, but things like swimming, yoga, tai chi, things that are all meant to strengthen are really good. Physiotherapy, osteopathy, I don't think we probably use physiotherapy enough as we should be doing. And I'm trying to get together with our physiotherapy team to see if we can get a package for people, specifically people who are on immunotherapy and targeted therapy, who are suffering from joint pain, to see if they can come up with a program that will help. TENS machine, I've heard, this is something from a patient, said that they had a TENS machine, which is like an electronic stimulation, something that people use in labour. It's not been proven to be effective, but it does help for some people. You can have a look on the NHS website and it'll explain how to use TENS and how to get hold of it. But either ask one of your healthcare team or ask your GP. I think you do have to buy it ultimately if it's something that you're going to use long term, but it is useful for some people. I found some very useful links. These are both arthritis societies that have fantastic web pages, and all of the things that they recommend will apply to people out there who are getting joint pains. So if you can just take a picture of that, these websites, or write them down, because they are very, very useful and do provide a lot of information. Sore mouth, dry mouth, again, not considered terribly serious by us healthcare professionals, but we do appreciate that these things can significantly impact your quality of life. They can affect your diet, your communication with people, and just to have a dry mouth constantly must be quite frustrating. So, also, if you have a long-term dry mouth, it can affect your dentition, so it can affect your teeth and your gums, and it can make you more prone to opportunistic infections like thrush and mouth ulcers. So, usually advised to visit a dentist prior to any treatment and get any dental work carried out before treatment. You can have dental work while you're on our drugs. They're not chemotherapy. They don't reduce your ability to fight infection. But it's always worth just visiting a dentist, and anything that's going to be problematic, to get that sorted before you start treatment. Obviously, maintain good dental health by brushing and flossing. Mouthwashes. The best mouthwash is probably salt water and baking soda. There are a lot of mouthwashes that you can buy that contain alcohol that can irritate your mouth. So I recommend, in a pint of water, about 1/4 of a teaspoon of salt and 1/4 of a teaspoon of bicarbonate of soda, and rinse your mouth out with that about 4 times a day, and stay hydrated. If you speak to your healthcare team, we can provide dexamethasone steroid mouthwashes that people find very helpful. And different things work for different people. Chewing gum helps some people, it doesn't help others. But you're the experts, I'm not the expert, you're the experts in all of these. It's common sense, really, but moisturise your food, use a lot of gravy, you can buy mist humidifiers that you can get in the room, which do help because the air is very dry inside. Good nutrition again. Eat warm food, don't eat hot food. And utter or milk. Add utter or milk. spot these things and not too late. Yeah, so add butter and milk to things if they're too dry. So things to avoid: alcohol in moderation. Drinks with caffeine can dry your mouth as well. Acidic juices can irritate the mouth. Any dry, coarse food. Don't smoke. Sticky, sugary foods. I don't know if any of you like sweets, but if I eat sweets, they make my mouth really dry. And any dental products like the mouthwashes that contain alcohol, because they can just irritate the mouth. So I talked a bit about distraction techniques for all of these things, to try and keep yourself busy and to have something else to think about. Deep breathing, even, we all breathe, but deep breathing is really helpful. It calms the mind, it relaxes the body, and it makes you focus on something else. And again, there are apps that you can get online for breathing exercises. Muscle relaxation, just kind of meditation. There are techniques again for relaxing your muscles. Again, you can see them you can get them on YouTube or on your phone. Positive thinking. Try and think every day what's been good about today, what's good about what's happening to me today, and try and see the positives in things if you can. I know it's not always easy. Meditation and imagery, again, it's a way of distracting yourself. It's a way of thinking about something else and perhaps changing some negative thoughts. And again, the same with mindfulness and, hobbies. We at the Christie we're lucky enough to have a Maggie's Centre, and there they do painting classes, they do writing classes. Most centres, so a lot of hospices and local centres will have daycare where they can put a package together for your needs. So you could go and say, well, I'm on treatment, it's working, everything's going well, but I am struggling a bit with the side effects. And they can go through that in detail and make a package for you. And that can include maybe some reflexology or some meditation. So do seek out help. There is help out there. People want to help you live the best life that you can. The aim of any cancer treatment is to keep you as well as possible for as long as possible. And we don't want that to dominate your life. We want it to be part of your life, but we don't want it to dominate your life. So, in terms of the treatment, I think I was asked to do this talk primarily because I think somebody had said to one of my colleagues, I can't go out for dinner that night because I've got to take my medication. And any of you who are on targeted therapy, the rules are you have to have it 1 hour before food or 2 hours after food. So essentially on an empty stomach, and it has to be 12 hours apart. That's a general rule. If you can do that most days, that's absolutely fine. You can miss a dose, you can take the occasional dose later or earlier. You don't have to live your life around when you need to take your tablets. You can even have a week off if you want a holiday. You won't come to any harm, I promise you. Stop the medication for a week and enjoy your holiday more if you're getting side effects, and it really won't cause you any problems. Check with your team and support services locally. Like I said, a lot of hospices, some hospitals have got Maggie's centres where patients can go and get lots of help. Macmillan services provide a free counselling service. So if you contact Macmillan, they will allocate you a counsellor, and you can get as much or as little counselling as you need. And they also have a buddy service, so they can match you up with somebody who's who's been through or going through the same thing and give you, I've been there, this is what helped me. I think you've all probably made some friends over the last few hours, so and I know a lot of people keep in touch with people that they've met here. So take advice from other people, and then Macmillan can also provide financial support if you're struggling financially with grants for necessities. So reach out to people. So thank you. I don't know how much time I've got left, Imogen.